Ilmini share on Shafti and Gilmore, Canada and Party looked
Cancorda, the Irish Cancer Society yesterday told us that up to 30,000 cases of cancer are now being diagnosed in this country each year. It's a lot in a country of just over 4 million, and they tell us that the numbers are increasing and that over the next 12 years we may face a cancer epidemic in this country. Now, before Christmas, on a number of occasions, we had exchanges in this House about cancer treatment and about things that went wrong in cancer treatment. We had the sad and tragic case of Rosie Long, Susie Long, known as to radio listeners as Rosie. We had the case of the women in Portlaoise who had been given the all clear for breast cancer and were then called back and had to be re-examined, and there was a case of several other cases of misdiagnosis. And on each of the occasions that we raised these issues with you, Taoiseach, and with your absent Minister for Health, the answers that we were given was that there were investigations underway and that reports would be presented and that we couldn't get answers to what went wrong in these cases until we had the reports. Now, there are 5 such investigations which are still underway. There's the Anne O'Doherty review into the cases of suspected breast cancer misdiagnosis in Portlaoise. That was to have been completed by the end of November. It's still not produced. There was the report by John Fitzgerald into the circumstances surrounding the release of information on the misdiagnosis of breast cancer in Portlaoise. That's still not completed. There was the report of HICWA into the circumstances surrounding the misdiagnosis in the case of Rebecca O'Malley. That was due to be published in December and we still don't have it. There was the report of HICWA of a review of pathology services at University College Hospital Galway in the wake of another breast cancer misdiagnosis where a woman was twice wrongly given the breast cancer all clear. That's still not completed. And there was the internal report by Cork University Hospital into the appointment of a pathologist, despite the fact that his work was subject to 2 reviews in Finland. 5 reports that are still ongoing and haven't been produced. No answers for the patients concerned, for their families, or for the wider public that's concerned about this. So I want to ask you, Taoiseach, when are we going to see those reports produced and published and answers provided, which we had asked for initially last October and November?
Gilmore.
Well, just going back over the Taoiseach's replies, first of all, as I understand it, the pathologist in Cork left and had left, in fact, before the investigation began. I think what we want to try and establish is how that pathologist was engaged in the first place, given the fact that his work had been subject to review in Finland. So again, I ask, is that we need to get an answer for that. And there's an issue about public accountability here. It's not just enough to say, well, he's gone and let's forget about it. We need to find out what happened there. I'm a bit confused as to the reply in relation to the O'Doherty report. Taoiseach, on the one hand, tells me that that's going to be published by in the next month. At the end of February, yeah. Now, it will be published, we've initiated, because you also said that it was being submitted to the Chief Executive of the HSE. The report will be published, Taoiseach. I have your assurance on that. The other reports then are the 2 HICWA reports, one in the case of Rebecca O'Malley and the other in the case of University College Hospital Galway. I don't think you referred to those, Taoiseach, in your response, and I'd like you to tell us when you expect those 2 reports to be published.